All right, there we go. So good evening, everyone. I welcome you to a discussion of violence prevention, which is sponsored by the League of Women Voters of Colorado's Task Force on Gun Violence Prevention. And I'm Rihanna Osman. This evening, Dr. Beverly Kingston of the University of Colorado will share some of her research findings with us. And her talk this evening is entitled, Using What Works to Prevent Violence. All right, we are recording this session, and the recording will be posted on the League's YouTube channel. Dr. Kingston will have time to respond to questions, and I ask that you put questions into the chat, and we'll address them at the end of her remarks. So before we start, I would like to remind all of us that the League of Women Voters is a grassroots organization that works to improve local, state, and federal government and engage all citizens in the decisions that impact their lives. The League neither supports nor opposes candidates or parties, but we do interact with elected leaders at all levels based on our positions on public policy issues. Our positions are formed after member research, study, and consensus. We are passionate advocates, both men and women, who work to influence public policy issues. And so now I'm pleased to introduce Dr. Beverly Kingston. She is the director of the Center for the Study and Prevention of Violence at the University of Colorado Boulder. Her research interests focus on addressing the root causes of violence by creating the conditions that support healthy human development throughout the life course. This includes building prevention systems that attend to the social and emotional capacity of youth and adults. She has designed, conducted, and led several multi-million-dollar school and community initiatives and research studies, including a federally funded randomized trial focused on school safety. These studies aim to bridge the gap between research and practice by working in co-creative partnership with school teams and community coalitions to strategically select and effectively implement evidence-based programs, practices, and policies using a public health approach. And so, Beverly, welcome.
Hey, everyone. Okay, I'm going to share screen, put up my PowerPoint. All right. Well, thank you so much for having me. It is an honor to speak to this group and very exciting to speak to a group that really aims to influence policy. We need you. We need you in this area. Also, I noticed that my colleague, Jonathan McMillan, is on the call. Jonathan, I'm really glad that you made it here and that, you know, maybe when we open it up, you may have, I'm sure you'll have some things to add at that point. Okay, so, and also thank you for that introduction. I just wanted to give you a little bit of background about our center. So the Center for the Study and Prevention of Violence was founded 30 years ago by the renowned criminologist, Dr. Del Elliott. And as is part of my bio, we aim to bridge the gap between research and practice to ensure that the best things that we know from research are getting into practice. I also have added to that I like to say that we're wanting to make sure that the best things from practice get into research. And Jonathan can say more about that later, but we really are learning so much from our community partners and then making our research agendas based on what the communities need. I've had the great privilege of directing the center for the past 11 years. And you know, basically, like was shared in my bio, we take the lessons from research. So it's not only my research, but from the whole plethora of violence prevention research to then design, implement, and evaluate strategies to prevent violence in our schools and communities. And we do that work in Colorado, across the nation, and we do have a project, an international project as well, where we work in Indonesia. So let's see. Okay. And I like to start my presentations. The motivating question that guides all my work. And so this is my motivating question. And it's, what are the best things that we can do to support the optimal development of kids and in communities. And then the other part of the question, or kind of second question, is, and then how can we put those into practice? And I'll just say a little bit when I went to, I got my PhD at CU Boulder, and I expected that if I just learn what those best things are, and we understand them, that's going to be enough. And over the years of my career, which has been about 25 now, I've learned that there's a whole science as well to putting what works into practice. Okay, so what I'm going to cover today, I'm going to talk about the problem of violence. So I'm going to be giving some statistics and kind of help you to understand what we're seeing today in terms of violence. I'll be talking about a comprehensive public health approach to prevent violence. I'll be sharing some best practices for violence prevention. There's a whole lot more, but I'm going to share some of the top ones that we focus on. I'm going to share some highlights from our projects that we work on as a center, and then end with some considerations around implementation. And I'll also be sharing some resources with you as well. And I'm happy to share these slides with you after the presentation, if that's helpful. And just so you all know around time, this presentation will be about an hour, and then we'll have about 30 minutes after for questions. Just wanted to tee you up to know what to expect. Okay, so I've recently been adding this slide because when we talk about violence, I mean, it is upsetting, and different people have different reactions. I want to say whatever you have is totally okay, but I do encourage you, as we're going through, to practice self-care, whatever that means for you. Take a breath, take a break, just take care of yourself as we go through the presentation. I really am stay in the hopeful place, but some of the stats I'm going to share are pretty rough right now. And you're probably, those of you who work on the task force and are real involved in following what's going on with gun violence I'm sure are familiar. So the next set of slides, I'm going to talk about the problem of violence. This slide shows increasing firearm violence in the US. And you can see from these slides that overall, both deaths are increasing and firearm-related mass shootings are increasing, have increased during this 4-year period. And this data comes, as you can see, from the Gun Violence Archive. We don't have past 2021, but I think we know from media that, the news, that these trends seem to be continuing. And then here in Colorado, we've suffered a high number of mass shootings. The number of mass shootings, it's the red line on this graph, and our state ranks 4th for the largest number of mass shootings by state in the United States. The yellow line is the number of fatalities, and the blue line is the number of injuries. So like if you look at 2022, you can see there were 13 mass shootings, 23 fatalities, and 59 injuries. So again, this data is from the Gun Violence Archive. So we're using their definition of mass shootings, which is 4 or more shot and or killed in a single event at the same general time and location, and they don't include the shooter in their count. So their numbers are, can be different than what you see. Like there's not a one common measure for mass shootings, and that makes it a little bit complicated. But kind of looking, when you just look at this data, you can see the trend. And then we're also seeing increasing firearm violence in Denver, and we're seeing similar trends in our cities nationally as we're seeing in Denver. We also know that communities of color are disproportionately harmed by gun violence. We know that Black youth are 14 times more likely than white youth to die by homicide. And, when you take a look at all this data that I just shared, we see this picture of increasing violence in our nation that I definitely am concerned about it. And I know you all are as well. And that's why you're here today. I did want to, I don't know if this question's coming up for you, but I did want to, I'm going to sort of dive into this question because I'm asked it a lot when I talk to the media. They want to know why, why are we seeing these increases in these trends? And so I've tried to, look, we can't all the way as researchers tell you why right now, like this is something that you find out years down the road and you do all kinds of studies, but I have, I can tell you what I share with the media. And I think things that we can recognize, and we can't say these are absolutely causal, but we can say, hey, these are broader forces that are going on. And so first of all, we're seeing unprecedented social stressors and during the pandemic and the aftermath. And we're seeing increased political polarization. We're seeing the climate change as visibly more present every single day. And I just went to a talk that was talking about climate change as a risk multiplier. Some of you may have heard that term before, and I hadn't. And I thought that makes so much sense, because as things get worse and affected by all what happens there, it can multiply the risk for violence. We're also, as I'm sure you all know, seeing increased poverty and inequality, issues with racism, structural racism, and all happening in a time where social media is ever present. I've been at a lot of conferences lately. I went to another one that was put on by the Department of Homeland Security and our state organization, Kayak, and they were talking about the concerning trends of the numbers of young people, and probably adults as well, being radicalized into hate groups. And that has the potential to then escalate to violence. And so that's, some of those broader trends that are somewhat can explain what we're seeing. So I wanted to share that with you as well. And I think this slide is really important. It's big picture, and let me explain what's all here. So first of all, as we all know, we know that violence is a negative outcome in itself. It decimates individuals, it decimates families, it decimates communities. But this slide, what it particularly shows is how violence is a risk factor for many other problem behaviors and poor health outcomes. So what you're seeing in these different ovals are all the different areas that violence, has these tentacles and impacts. So violence impacts, maternity and child health, disease outcomes, mental health problems, risk behaviors, and injury and life opportunities. And one of the reasons I absolutely, love working in violence prevention, because it's such an amazing lever of change. By impacting violence, we have the potential to then impact all of these different outcomes. So it's a key lever to impact. We also, and this is good to know for you, and you may know it already, but know of the financial cost of violence. Firearm injuries cost the United States over $229 billion annually due to lost work, to lost productivity, lost quality of life, and criminal justice cost. I think those costs are under, they're lower than they really actually are. And that's only talking about firearms. So, other violence is also going to be impacting those costs. What really is important, what we're here today looking at and doing. So in our center, we use this metaphor of an iceberg to help understand violence. And when we talk about the iceberg, we think about the tip of the iceberg being those mass shootings, the homicides, the suicides, the things that we just saw in those slides. But underneath the tip are concerning behaviors, including physical fights, depression, suicidal ideation, And I want to give you a little bit of those statistics as well, because they're also different forms of violence. So we consider suicide, violence against self, violence against each other as forms of violence. And so these lower levels are also important to consider. So according to national statistics, and these are CDC Youth Risk Behavior Survey data, 33% of our high school youth have reported being in a physical fight at school in the past year. 28% of middle school youth have reported being bullied. And this is the number that, like, those numbers are pretty stable, but this number that I'm going to give you has really gone up. The number is 25% of our high school youth have reported seriously considering suicide in the past year. So in 2021, that number was 19%, which was quite high. And now, the latest data, 2021, it's 25%. And just a couple other nuances with this. We're seeing those mental health concerns being even higher for girls. And I just got this stat at a conference I was at in August, and I can give you the citation for all of these after if you need them. But this was an alarming one. So suicide death rates for Black teenage girls increased by 182% from 2001 to 2017. And I want to get this information out. So I think it's very important to, that we pay attention to different populations, and we're really watching out for how violence is impacting all different populations. I don't have time in this, in this presentation to cover all that, but I want you as a group here to keep that in mind. And then we go deeper underwater. And deeper underwater, we see those underlying conditions, the broader social forces that contribute to violence. And there we're talking about racism, structural racism, poverty, collective trauma. And so what we talk about as a center, and this is, what is in my bio about those root causes, if we want to address what's at the tip of the iceberg, we need to address these underlying social conditions. So my next set of slides is going to be talking about how we address those underlying social conditions. And we do that by using a comprehensive public health approach. So I'm going to go into what are we talking about when we're talking about a comprehensive public health approach. So fortunately, research does find that using a comprehensive public health approach offers the greatest potential for not only preventing violence, but also for promoting mental and behavioral health. So a comprehensive approach addresses those root causes of violence by focusing on the underlying risk and protective factors, and also those deeper societal forces that fuel violence. So this slide shows those underlying risk factors for violence. So just like there's risk factors for heart disease, for stroke, for cancer, and they have shared risk factors, like if you think about, high blood pressure, that's likely shared across all those conditions. There's shared risk factors across all these different forms of violence. And again, these risk factors that are listed on the left can be thought of as those key levers to address for change. The other thing, it's not shown on this slide, but we know it from research, is that these same risk factors not only impact violence, but they also impact other kinds of problem behaviors like substance misuse or school dropout. So again, you can get excuse the language, but this is kind of one of those things in the language, but bang for the buck, I guess, when you're addressing the these levers of violence, these risk factors for violence. I also want to say something I've been really paying attention to, and the literature hasn't fully caught up to it, but more and more research and literature is coming out about this, that we're starting to really pay attention to is so important. The way that racism impacts these risk factors. And let me give you an example. So, for example, years of disinvestment in communities of color, years of racist practices like redlining and unfair lending practices have created inequality in the resources and supports that are available in these communities that then contribute across the life course to healthy youth development. And I'll just give you a little addition to that. So my research that I did for my dissertation actually looked at Denver neighborhoods, and it showed that Denver neighborhoods with the highest rates of youth violence also had the highest rates of poverty and the highest perceptions by youth of limited opportunities for their future. So it was both limited real opportunities and limited perceptions of opportunities. And so those play into how risk factors actually, how they map out. They're not the way risk is not all equal. And so I wanted to share that as well. I don't have a slide that shows shared protective factors the way I have for risk factors. That's something that I'm hoping we're going to get. Jonathan might be able to speak to if we are going to be getting that soon. But I did want to anyway show some of the key protective factors from research that really matter in terms of preventing violence. So supportive pro-social relationships. We know for young people, we want to make sure every young person has at least one trusted adult in their lives. We also want to see pro-social involvement within schools and communities. I'm just going to quick flip back to that last slide where you can see this social isolation as a predictor for all kinds of different types of violence. So when we're talking about pro-social relationships, pro-social involvement, that's an antidote for that social isolation. And then, of course, strengthening social emotional competencies. So helping all of us to be able to better manage our emotions, have that self-awareness, have better relationships. Those are all, key protective factors. Like I said, I don't know. The last couple of weeks, I've been at so many trainings. It's just everything hit in September. So I'm going to share one more. There might actually be a few more that I'm going to share, but I had the privilege we brought a speaker into CU Boulder. His name is Dr. Jeffrey Cohen, and he's a social psychologist from Stanford. He has a book that's focused on the science of belonging. And I loved the way he presented his findings. So he emphasized 3 areas, and I can, follow up with you after and also give you the link for his book as well. But the 3 areas that he was saying are so critical is making sure that people are seen, that they know that they have potential, and that they know they are not alone. And again, those 3, where he's talking about belonging, but you can think about belonging again being that opposite of social isolation. So what he's promoting, I think, are also violence prevention strategies as well. Okay, so a comprehensive approach addresses what matters most for preventing violence. And what I'm going to mostly focus on in my presentation are these 2 areas: upstream prevention and intervention, and identifying and addressing the warning signs for violence. There's other parts of a public health approach that a comprehensive public health approach that I'm not covering today. I want to make very clear that firearm policy is absolutely a part of a comprehensive public health approach, but I'm not going to be going into that today. However, I do have resources for that at the end. So again, I want to just sort of set up expectations, and it's not that is very important. It's not an area that we work on in our center is directly, but we certainly support researchers and pay attention to that research. So I commend you for the policies that you have gotten passed, and way more needs to be done in that area. So, but I'm going to focus on this area, and the areas that I am focusing, I think, are not part of the public conversation. as much as I hope that they can be. So hopefully some of the stuff that I share, you'll find ways to think about how could these pieces be brought into policy, and I would love to, to continue some of those conversations, because we need that. Okay, so a public health approach, as I was talking about, a comprehensive approach focuses on both intervention and prevention. So intervention waits until the person has fallen into the water, and then it throws that person a life preserver. And the good news is we have effective programs, evidence-based programs to intervene with youth and families that are struggling with behavioral or mental health concerns. A prevention approach equips kids and adults with the tools that they need, a life vest that they can use if they fall into the water. But we can also go I went to one slide too far. We can also go to another level, and we can go even further upstream, and we can teach our children how to swim. And by that, I'm talking about we can provide social emotional programs from preschool through elementary school that teach kids how to manage their emotions. In middle school, we can be providing life skills training programs. High school, we can be providing safe dating programs, service learning opportunities that focus on, pro-social engagement and involvement. So now I'm going to turn to that second area, which is talking about addressing the warning signs for violence. And so this is a really critical dimension, and we need both, these upstream prevention programs and intervention programs. We need to teach our children how to swim. But in the society that we have today, we really need to be watching out for the warning signs. So what we've learned in research, this comes from a study by the Secret Service I think this is the study from 2004 that I've got on here. But let me tell you, this data has been replicated over. And so what we know is that in way too many studies is that that in 81% of the cases that have involved mass school shootings, the attacker told someone else what they were going to do. They were blatant and told someone else. In most cases, it was a peer. And then in 93% of the cases, the attacker exhibited behaviors that other people saw that caused concern. And so what's so critical about this information from a violence prevention perspective is that these are visible warning signs that other people see that can provide opportunities for intervention. What I am sad about, and as you're going to get more in this presentation, really seek to change, is that we miss these warning signs over and over again. I mean, sometimes we don't usually hear about those cases. And I hope we can do more to show when we avert violence. We do have, I didn't put it in this presentation, but there is an averted school violence database that's trying to learn from attacks that we've averted. But what I'm also know is that there's so many missed opportunities. So for example, we did a study on the Arapahoe shooting, and in that shooting that happened in 2013, we counted 27 missed opportunities to intervene. In the Parkland shooting, there were at least 69 missed opportunities. And again, these are when we study after attack, the lessons that we learn. So we want to learn from those lessons and make changes based on those lessons. And so this next slide, let me share from here. This next slide shares what those warning signs are. And yeah, it has that basically this bigger list. Many of these are common things that lots of people have. So it's very difficult to know, who's going to escalate and who's not. But I did highlight those first three, because when you see those first three together, we start to say they're on, a young person is likely on a pathway, or an adult, to violence, and they become more imminent and pressing to address. When we're looking at studies from mass shooters, they had at least 5 of these. And again, typically there's lots of people in their lives who saw things and, noticed things that were concerning. And along with that, we've seen that we have gaps in our safety systems to address, those concerns. And so when we work with our school and community partners, what we're trying to do is focus on improving all of these 5 systems so that they're able to address those warning signs and cries for help at the earliest point possible. We want to get there way upstream so someone isn't going along that pathway to violence. So I'm just going to give you a little bit of an overview of these 5 areas that are in this pie-like diagram. So the first one, culture, climate, and community, there we emphasize focusing on a positive school climate and culture. I like to go even beyond schools, though, and think about what's the climate in our community. I talk about culture and climate being created in every single interaction and being something that the whole community needs to be thinking about and involved in. And you'll see when I share some of our interventions that we work on, they're about that. They're actually about that. That's not so abstract. We can actually make that tangible. They also focus on mental and behavioral health systems. And we want to make sure that individuals have access to high quality, culturally responsive mental and behavioral health supports. Got a lot of work to do in that area. We want to make sure we've got strong systems in terms of what we call bystander response and reporting. We want to encourage people to be upstanders and report those concerning behaviors. But we need to have really strong systems when those reports are made. And that comes, then we talk about information sharing. So information sharing is about making sure that information about behavioral concerns is shared appropriately across systems. So for example, between law enforcement and schools, or law enforcement and juvenile justice in schools, or all those in mental health. And we want to do that in ways that are with great care, because the last thing we want to do is call people out in inappropriate ways. So we're really looking at ways, we're working with state partners right now to build out those systems, not only state partners, but local partners as well, to look at how do you do that well. And there's a lot of misunderstandings in this area. And, this goes back to our center was very involved after Columbine. And that was one of the biggest findings in Columbine, was this lack of information sharing across agencies. And I believe that that there's some legislation maybe going forward in Colorado around information sharing. This would be a great area to look at how we could get better at this, and maybe how legislation could support it. Again, taking great care, because sometimes we put things in policy that can, don't know, that you don't always think about all the sides. Not that your group would ever do that, but sometimes that does happen in policy. But I would, I just know we need it, and we need to take great care with what it looks like. And then behavioral threat assessment and management is another system that's critical in order to promote safety. And I don't know if all of you know what behavioral threat assessment and management is, but it's a process where we train a team to help to identify if someone who's exhibiting those behavioral warning signs is actually posing a threat. You can make a threat, but people make threats all the time. It doesn't mean you're actually posing a threat. So this is a very rigorous process to be able to understand if the situation is potentially dangerous. It involves a multidisciplinary team. And it also, we don't just call it assessment, it's also called threat assessment and management, because it's so critical that there's long-term follow-up. So these are systems that when they work well together, they can really prevent people from going down that pathway to violence. and they can ensure that if someone does slip through the cracks, other people are watching out and intervening. So for all these systems to work well, we must create cultures and climates of safety, respect, and emotional support. And this can sound like light and fluffy. It's not at all that way, and I'll explain why. And this is actually what, believe it or not, the U.S. Secret Service emphasizes, how important the culture and climates that we create must be this way. And so first of all, cultures and climates of safety overall reduce the likelihood of violence, of bullying, of other problem behaviors from happening in the first place. Second, if challenges happen, people are more likely to speak up in a climate of safety, respect, and emotional support. They're more likely to feel a sense of trust. These climates are also way more likely to encourage upstander behavior, to be talking about, when do you report? How can you safely report safety concerns so that things can get addressed early? And cultures and climates of safety and respect are much more likely to be able to address a concern. So they're more likely to have systems that actually function well together and be able to address those concerns so that they don't slip through the cracks. So again, thinking here about how do we build those cultures and climates of safety and respect, and thinking about this as a violence prevention strategy. And I'll get a little bit more into that one when I talk about best practices, which actually is what I'm doing next. Which hooray, I get to talk about some of those best practices. Again, I mean, I could be here with you like all day really to talk about best practices, but I'm going to give you some highlights and keys that, again, maybe you'll think about as you're thinking about policy. I'm so thrilled to be talking to a group that is thinking about policy. So these are what I'm going to cover today. I'm going to talk about assessing school climate. I'm going to be talking about building a multi-tiered system of supports. And within that, I'm going to talk about a few key strategies: bullying prevention, positive youth development, and I'm going to talk about evidence-based programs. I feel like that's something that's really important, especially when you were thinking about policy. And then I'll cover some of those strategies that we can be putting into place to address warning signs. Okay, I'm excited because I love these. I love what I get to share with you. So I know I'm a little bit geeky that I get so excited about assessing school climate, but school climate is not abstract. It can be measured. And we have been measuring it for years and years with schools and the schools that we've been working with. We recommend administering climate surveys to both students and staff. And it's really important to do both because they have different perspectives and you'll get different information from both populations. And when we talk about staff, we want the school bus drivers, we want the custodians, we want everyone at the school to weigh in on the culture and climate. So assessing school climate helps us to understand the actual strengths and challenges related to both school climate and student behavior. So we're not guessing, so that when we're thinking about what strategies we should be intervening with, we're using a data-based approach, and using data to make decisions is very much part of that public health approach. And then we recommend that schools conduct climate surveys to monitor what they're, the implementation of what they're doing over time. So we ask them to do it either annually or semi-annually. That way they can see is, hey, they'll be able to set their priorities based on data, and then they'll be able to say, is what we're doing working, or do we have a different problem that we now need to address? So this data-based approach is absolutely critical. Now I get to share one of the best stories that have happened to me in my career. And that is in 2018, my friend and colleague, Carly Posey, some of you may know Carly. She works for the I Love You Guys Foundation now, but she described to me her son's experience taking our center's school climate survey. So Carly's son, Rakin, he witnessed his teacher and classmates shot at Sandy Hook Elementary School. And when the gunman paused to reload, Rakin and 8 others of his classmates, they were the ones who ran out of the classroom and escaped to the fire station that was nearby. And it so happened that Carly and her family had already been planning to move to Colorado the very next day. They live in Douglas County. And as you can imagine, I mean, because they moved to Colorado, it was very difficult. Well, no matter what, it was very difficult for Rakin to attend school for many, many years. Carly attended school with his mom every day for many years. And when Rakin made it to 6th grade, he was at Cimarron Middle School. He took the school climate survey that we use, and neither Carly or I had any idea that was happening. I knew his school was doing the climate survey, but neither of us knew when he was taking it. But he came home from school that day and he told Carly about it. And he said that taking the survey made him feel safer at school. And, Carly's like, why? What happened? What made you feel that way? And Rake said, because the adults are listening to us and they're going to make our schools safer. And so that really told me that, I don't know the strength of the effect, but that doing that survey, and if you talk about it in your, you explain to kids why you're doing the survey and you give the data back, back to the kids and you engage the kids in the whole process, that is an intervention even in itself. And I hadn't thought about it that way until I got that information back from Rakin. Rakin, I believe he's a senior this year, or he just graduated. I'm not sure which one. So he's doing great. And Carly has given me permission to share this story. She wants me to share this story because it's so important. And she spends her career really trying to get information out to communities and schools about what we can do to help, like I'm doing, to help make them safer. Another thing that's a best practice is to build this multi-tier system of supports. And I don't know if you have heard of a multi-tiered system of supports, but when we're talking about it, basically what it is, it's a term that we use a lot in education. It's also a term that we use in public health. But when we're talking about a multi-tiered system of supports, we're talking about having interventions at all of these 3 levels. So universal prevention strategies are what's in place for all kids. Targeted interventions are what's in place for those that are at risk for violence. And then intensive interventions are what's in place for those who are already exhibiting violence or really struggling with, with concerning behaviors. You may have heard the term, primary, secondary, or tertiary. That's another way we talk about this. But the bottom line is we want to make sure that we've got strategies at all 3 levels. Okay. So another best practice is that we want to make sure that we're focused on bullying prevention strategies. We want to make sure that our environments are physically and emotionally safe. So in order to create that positive climate and culture, they need to be physically and emotionally safe. And that means we've got to take care to make sure that bullying is not going on. Students that are bullied, we know that can have lifelong consequences. Kids who are bullied are more likely to be anxious and depressed, abuse substances, have poor physical health. They're more likely to struggle than other kids in both adolescence and adulthood. There's a lot of research that shows those long-term impacts. Kids have different reactions to being bullied. Some may internalize, they may go to substance misuse, others may externalize. And in those situations, it can lead to anger and grievances that can potentially fuel violence. So bullying prevention is a universal strategy that the whole school or community can really focus on. It's about creating norms that don't tolerate bullying. These systems are really critical in terms of making sure that, I want to go to this next slide real quick. These systems are really critical as well. And along with that, we want to make sure that we think about, again, differences. So there's some groups that are at higher risk than others for being bullied. And we know kind of the thing that's common across all these groups is that when kids are different for any reason, body size, because of their sexual orientation, gender identity, all these different kinds of things, they stand out as different from their peers. And so we need to make sure that when we're doing bullying programs, we're specifically addressing these different populations and that we're including strategies that target gender-based and homophobic kinds of bullying. And that's really going on pretty intensely right now in our society. Just kind of to keep things going. Okay, so another universal strategy is focusing on positive youth development. Wanted to make sure to put this in here because this is something that we all can be doing as parents, as grandparents, as community members. We can practice nurturing the core internal strengths and abilities of our children and teens. And we can provide opportunities, skills, and recognition so that our young people believe in themselves and their abilities. That is a violence prevention strategy. Another one that I really want to kind of is like emphasize because it's something that's really doable. We can also reduce risk and build protection by making sure that every kid knows their spark. And the spark is a term that was coined by the Search Institute. There's been quite a bit of research on this idea. Spark is a special quality. It's a talent or interest. It's a thing that gives us energy and joy. It's like what's unique and special about us. And when we express it, we feel amazing. So one of the best things we can be doing is to be noticing each other's spark, that we can make sure that our young people have champions and opportunities to support their spark. So as mentioned, I wanted to also share with you a little bit about this continuum of evidence. So when we're talking about that multi-tiered system of support, that triangle that I showed you earlier, we want to make sure that we're implementing programs and practices at all three of those levels. So universal, for all, for those at risk, and for those already kind of in trouble or already exhibiting those behaviors. We want to make sure that the programs we put into place have the best available evidence that also fit the local context. So we use this evidence, this continuum of evidence, to help people understand what are we talking about when we're talking about evidence. And I'll tell you, as a researcher, I've written some papers where I talk about, I call it like evidence-based confusion, because there's a lot of confusion about what we mean by evidence-based. So let me explain it here from this slide. So when we go to the left side and we talk about what's in red and is harmful, those are programs and practices that have multiple randomized studies and have been shown to do harm. There are programs like that, like Scared Straight, Zero Tolerance, and boot camps. Hopefully those aren't being used anymore. They still may be being used. When we talk about harmful, that we also use the word iatrogenic. You may have heard that in research that says that they not only don't impact violence, they actually. Then we've got the lighter red where we've got the ineffective programs. Those are programs that have been rigorously evaluated and have been shown to have no effect. So, for example, the DARE program went to scale nationally, but it was aiming to impact substance abuse, but it had no impact on those outcomes. There's many programs, most of the programs are in this light blue category, where the programs are theoretically sound. We think they'll work. We may have anecdotal evidence. People have said, oh, I like this program. This seems to be good, but we don't know from research if it does work. Then we've got a set of the next is the darker blue, promising. And those are programs that do have some research evidence, at least pre-post, but ideally, at least one randomized trial, a quasi-experimental design. And then we've got those programs that are effective, that these are what we would really say are evidence-based. They have multiple randomized trials, ideally not by the researchers who designed the program, an external evaluator. They have sustained effects over a year. They've been tested on different populations. Those are the programs, when we think from a policy level, we want to take to scale. It doesn't mean what we've got to do with the programs that are in the unknown category is we've got to evaluate those programs. And I do want to say that many of the programs that have that evidence-based have not been tested on communities of color or different populations. And so we've got to do a better job of really getting the grassroots programs and evidence-based. And so that's some of the things we're trying to work on in our center. I did also want to give you this resource. Hopefully some of you have heard it. This is our Blueprints for Healthy Youth Development. And the Blueprints is a registry of evidence-based programs that are across those three tiers, and they address violence outcomes, but also many of the different healthy development outcomes, educational outcomes, health outcomes. There's over 100 programs on the Blueprint list. But I will say that the Blueprints registry, it's the very highest evidence-based standards of any registry. And it really is kind of like getting to the Olympics to make it on that list. So you can be very confident that what's on that list are evidence-based, but we have a long way to go to make sure that some of those programs on the list will serve all the populations that need to be served. There's still a lot of gaps of programming. I don't have time to get into all that, but one of the things I want to share with you that we estimate, if we were able to put these Blueprints programs to scale, we could reduce violence by 30%. So they're not to scale. That's one of the things we really want to see change in our society. And then just a couple other slides around these best practices. So as I've talked about some of these different strategies, we want to give training on the warning signs for violence, including using Safe to Tell. We want to improve our systems on information sharing. And we want to really make sure that we've got behavioral threat assessment and management systems in place, both at our schools and within our communities. We have a big gap in behavioral threat assessment and management at the community level. So we do pretty good in schools, but we don't have systems in place when kids graduate, or if they're not in the university, or they're young adults. And so that's a big gap that we're seeing. Also wanted to share with you another strategy to address warning signs is safe practices. And there's good evidence that counseling and locking device distribution really matters. And so we're really trying to get that information out there, and that this is an evidence-based strategy that does work. So just these next slides really quickly, because I want to leave plenty of time for questions. I did want to just share with you, this is a list of the different projects we have at our center. And I'm not going to go into depth with these projects. You can check them out on our website, but I'm going to go a little bit more into a few of them, but I know I don't have time today to go into great depth, but I've got our website up there, and you can, we've got a bunch of information about the projects on our website. I'm super happy to talk with you in more depth about the projects. And as well as I can get you in touch with we've got directors of each of these projects. And so you could also talk to them and talk to some of our community partners. But I did want to, go just show you a little teeny bit more. This is we're a nationally recognized youth violence prevention center. This is a project that's recognized by the CDC. We're one of 5 in the nation, and we're working in 2 areas in Denver, Northeast Park Hill and far Northeast Denver, which encompasses Green Valley Ranch and Montbello. And both of those communities have rates of violence that are above the national average. And so this is a super cool project. This is how I've got to know Jonathan, because he's been part of this work for many, many years. We've worked in these neighborhoods since 2011, and we're in our 3rd round of funding. And this round, we're just doing some really, really great things in partnership with the community, and the community identified the strategies that we're putting into place. I just don't have really, I think, the time to go into depth in the strategies. We're also doing a project, we're in the last year of it, that's funded by the Department of Homeland Security, and it's a violence prevention project with CU Boulder and the Boulder community, where we're actually training students, faculty, staff, and community on those warning signs for violence. We have a social media and awareness campaign where we actually have brought Safe to Tell to the Boulder campus. Safe to Tell is an anonymous reporting system for everybody, but we have actually really been promoting it on the campus in Boulder, because a lot of the college students, we found out, don't really think it's for them when it is for them. And so that's been really, really cool. We've launched the social media campaign, and I can give you again more information about that. And also part of this project is that I thought your group might be interested in is this threat lethality checklist for law enforcement that we've developed in partnership with law enforcement. And it's 14 items. It's a 14 or it's 12 items. Okay. It's a 12 item assessment, and it really will help law enforcement to understand when they're out on a call, is this like potential lethal situation? And it's built somewhat off the domestic violence checklist. Some of you may know about that. Yeah, I can give you more information about that outside of this, but I thought you may be interested in it. And it might dovetail in what you're doing. So we also have this great work that we're doing with our Safe Communities, Safe Schools, and many projects we're working with actually right now about 40 schools, but we've worked with hundreds of schools, mostly in Colorado, but some nationally, to help them apply that comprehensive approach to build those key safety systems and use their data. And it's a really great program. If you know of schools that might be interested, you can reach out to me and I can get you in touch with the leader of that project. And then just, real quick, I do want to say that these implementation considerations and resources are critical. So in my work with schools and communities over the years, which it's been many years, and actually I've been saying this flooded thing even before the 2013 flood. So it was 2013, wasn't it? It's been a long time, but the people that are on the ground that we're asking to do this prevention work are absolutely, overwhelmed. And when you're flooded and overwhelmed, it's really difficult to take proactive action. And so I ask you, as you're thinking about policies and practices to provide the needed support and resources to those who are on the ground working on upstream prevention. And what I talk about when I'm talking about these resources, I'm talking broadly about this idea of a prevention infrastructure. And just like we have roads and bridges, we need to build an infrastructure of prevention, an infrastructure of supportive, dependable relationships, and focused resources to prevent violence and promote healthy development. We do not have this now in our society. What we have right now is absolutely piecemeal. It's grant funded, it's way underfunded, and the grants go away. Every time, like I watch over and over again, that the communities that are under-resourced are then asked to sustain the scraps of funding that they're given. So I really, if there's ways that you can be working on building a sustainable prevention infrastructure in our state, that would be absolutely incredible. And just to break down, what I'm talking about is the characteristics of a prevention infrastructure are the things that we've talked about today. That addresses the root causes of violence. It addresses those risk and protective factors using a comprehensive public health approach. It includes intervention and prevention across those 3 tiers and systems of support. It promotes a culture and climate of safety. It addresses the warning signs for violence, and it includes implementation supports. And I didn't get, I don't really have time to get into the details of those implementation supports, but I will throw out the terminology implementation science. There is a whole science around implementation, and we need to take that into account. We can't just fund the programs. We also have to fund their effective implementation. And again, having been on the front lines of this for over 25 years, I've learned the hard way, when we only put the dollars in for the program and not the implementation supports, we're not getting the results we need to be getting. You got to fund the full enchilada there. And last, I'll share this slide. I always like to end with that there is really great hope. We have so much because we do know so much about what works. And if we come together and we pool our resources and our brain power and all our gifts together, we can do this. This is why I am talking to you right now in the evening, and I will keep talking to groups and keep trying to get this message out, because we can do this. We can reduce, we can prevent violence. We can do a lot better. And so here's a list of some of those resources. This last resource, hopefully you've seen it before, but if you haven't, and you really want to look at some of the best stuff around gun policy, I love the RAND group. They're bipartisan. They really look rigorously at the research, and so I often cite them when I'm talking about anything to do with gun policy. So I will thank you so much. I will open it up now for questions, and I can stop sharing screen so we can see each other, and I certainly can go back to different slides as well if we need to. So thank you for sticking with me.
Well, thank you, Beverly. Let's see what we've got in the chat. People were chatting, which is always good.
Yeah.
Let's see. We're seeing some.
Great. I didn't look while I was presenting, so I wouldn't.
No, you shouldn't.
Yeah, I couldn't.
That's all right. Eileen, you put in a remark about data not including suicides. Which data was that?
Yeah, probably the data I was sharing at the beginning, I'm guessing, but let's see.
In case Eileen's already left, I don't see her.
Go ahead, Stephanie.
It was the data from the Gun Violence Archive.
Yeah.
And it's a great resource, but the suicide deaths are always a year behind, at least a year behind, because the Gun Violence Archive gets it from the CDC.
Yeah.
And so that's always behind. And so the data that were reported appeared not to have suicide because in 2021, the gun violence deaths were somewhere in the neighborhood, I put it on the thing, of 48,800.
Yes.
And we know that 55% or so of firearm deaths across the country are firearm suicides. So so it's right. So that year, 2021, there were about 29,000 or so firearm suicides.
Oh,
29,000
okay.
in 2021.
Yeah. And that is, so yeah, someone wrote me about what about firearms in the home, and I absolutely want to comment about that. Well, a couple things, because so safe storage, and Jonathan, jump into if you want to add it into this. But that safe storage, so that, that is something that we absolutely can do. Lock up those firearms, get them out if those really, those imminent warning signs are close. You really want to make sure those firearms are locked up far away. That is an actionable thing that every one of us can do, and it's some of the stuff I'm talking about, I know is hard and complex. I'm a sociologist. I look, I look at the big picture. And so what I love about this is tangible. This is like seatbelts, we can put the seatbelt on, we can take that action, we can promote how important this is to do. And this is the safe storage also can be bipartisan. So I didn't get into this, but one of our projects is called the Gunshot Project, and we're evaluating an intervention where they're working with CDPHE, where Jonathan works. The Colorado Department of Public Health and Environment is working on, helping the owners of gun shops, the customers, the employees understand and promote safe storage practices. So this is something that we can all rally up behind, and it can make a huge difference. It's something that we're in our social media campaigns with young people, we're encouraging them to watch out, and watch out for each other, promote safe storage at home. It's just something that there's a term called collective efficacy. We can all act on. So collective efficacy is us coming together to take action. There's individual efficacy. This is collective. And this is an area that I would love to see us really work on together as a state. Can we be like number one in this, And so so there, I got another question about decreasing access to firearms in the prevention infrastructure. Absolutely. Because we know that, and I'm always, every time I do the presentation, I'm like, okay, I can add that. We do know that access to firearms is a risk factor, and again, the safe storage practice and other practices to reduce access matters. I haven't done this presentation to the state legislators. I would be happy to do that, and I could do that with colleagues. I could do it, if you can help me, help us, maybe Jonathan and I could do something like that together. I agree. And if you feel like this would be helpful, all I want to do is share this information so that it can get out in the biggest possible way. So I'm happy to share my slides, you can do the presentation, I can do the presentation, whatever would be the most valuable. We have Jonathan and I, he has a question.
And
I'll say
Jonathan,
this,
you're muted.
and Jonathan, I just want to say this before you talk, is that Jonathan and I created a presentation that we have given to our young people that work in the Denver community, and they have actually gotten trained. We developed like the base of it, and then they're actually giving it now, and it's very exciting that that's happening. So all I want to do is get this out. That is the public health. So go ahead, Jonathan. What do you got?
Well, one, can you go back to that slide with that really handsome group of people standing there in Park Hill? There's a guy who looked familiar there.
I will. Hold on. Let me go to it.
I was just kidding.
Okay. I do want to, though. It's kind of fun because, are you in that one? I guess you are the handsome guy. Let's see where it is. This one?
I'm dead smack in the middle there with Julian in the front. So for those of you who don't know me, hi, I'm Jonathan. I'm the director of the Office of Gun Violence Prevention, but also just very, very, very committed to this work. I raised my hand because as we were talking about adding decreasing access to firearms in the prevention infrastructure, I think that's a fantastic idea. I think there was another comment in there about access to firearms being a risk factor. And Beverly, I think you also added, or you spoke to this point about the need for policy and people who are going to be advocates and lobby for the policy. If I may, for just a second, this opportunity, I don't have my hat on as the director of the office. I really want to encourage, as we have these types of conversations, that we remember that this is a comprehensive model, right? So it's not either or. That the word that if we really want to have success in finding solutions, we have to use the word and like looking at those upstream behaviors that we can really impact as far as the identifying the risk factors, addressing the risk factors, identifying the protective factors, and these are things like, as far as the spark. I love that as a protective factor, and it's just not unique to young people. As we know, we've mentioned it in even this conversations. We talk about suicide, suicide with our veterans, suicide with working age men, suicide with our elderly population. That human connection, that interest in demonstrating interest in what gives a person their spark, is a protective factor, and reducing access to lethal means. Right. So as we have these conversations, Beverly, I think you said it great about this group using leveraging its influence and its voice with our lobbyists. Also encourage them to not just look for that magic wand or magic spell that's going to end gun violence by, for example, the extreme risk protection orders. I think they're a fantastic tool incorporated with identifying those 3 top threats that Beverly talked about, or the 5 that off of that list, or looking at learning what the risk factors to look for when somebody's in a suicidal crisis, identifying those things and helping people normalize connecting and acting on those crisis signs are a huge part. And I'll shut up now because actually I have to leave to go pick up Julian from school.
Okay. Yeah, Jonathan, thank you so much. And I think all of that, the suicide information, that's why it's like we tend to separate all the different problems, but instead of thinking about what are those levers that are going to have the biggest impact on many of those problems. And you all are asking such good questions. I can't wait to answer or try to answer some of them. So there's this one in here about this. Has anyone identified common denominator motivations for violence, such as shame, what strategies has public health found to be effective at reducing violence? Yeah, I have to say, Jonathan, I don't know if you want to weigh in on any of this. Don't go yet if you can help it. But as a sociologist, I realize my training has been so much more in these like broader risk factors and not as much in the psychological dimensions of of what actually happens when what leads people to form those grievances. That then there's a diagram we often use. It's not perfect, but it's called the pathway to violence. And the idea, it's almost like, yeah, you can probably look it up, or I can, if you want to email me after, I can send you some of it. A lot of times they use that when they're talking in the field of targeted violence, which is, violence that is premeditated. It's mostly what the mass attacks are, targeted violence. But it seems to be that there's like there's a grievance, and that, different things lead to that formation of this like escalating anger and a grievance. And then when you get to that place, again, I'm not the psychologist, but what I've learned around it, and again, to talk about it more at that individual level, it seems that different things can then start to happen where you're then maybe, how I gave those risk factors, you're not, oh, I didn't give some of this. So in youth violence, there's these three really strong risk factors for youth violence. There's weak pro-social bonds. So you're not bonded to family, peers. And then from there, a lot of times the young person starts getting engaged in hanging out with negative peers. Or what may happen is they're starting to, go online and find others who don't feel like they belong. And a lot of our hate groups and things like online become like a place to then radicalize toward violence. Another strong predictor of youth violence is early and persistent violent behavior or problem behavior. So our 4th and 5th graders who maybe are carrying, bringing weapons to school, have exhibited violent behavior, are using drugs and alcohol at that real early age. So those three, from a sort of a more population standpoint, are strong predictors of violence, but those three don't predict at the individual level. At the individual level, you're going to be watching out for those warning signs. You're going to be looking at those pathways for violence. You're going to be, does that make sense? And again, we could talk more about that, but I want to learn more. I feel like around how does that, I want to work more with social psychologists and some of the psychology people to link the broader social way I approach it to that individual, so that we make sure that we're uniting our approaches and being real effective. The threat assessment process I was talking about is a great tool to intervene on that pathway. Ideally, we're intervening way earlier, but when something is escalating to the level that it needs a threat assessment, that's what you can do is you do that assessment, and then you get that young person or adult matched to the resources that they need. So those evidence-based programs, some of them are on the blueprints list. Like we've got things like multi-systemic family therapy or functional family therapy, things that have like a very strong evidence base that they actually work to then reduce violence. So again, I want to see us funding what's proven to work to scale, but also funding innovations, because like I was sharing, those things that are proven to work there's many gaps, and many of those gaps are in serving communities of color and getting the resources to those communities. So we can't only fund the evidence-based programs. We've got to fund the evaluation and building more of the evidence-based programs, if that makes sense. So anyway, I can get really passionate about this. Let me see what else. Oh, oh, that's such a great question. I'm looking at this one. Are there estimates of the amount of money and length of time it would take to bring the prevention infrastructure to full scale to the city of Denver? Jonathan, I feel like we could make that. Have you estimated that yet? It's not going to.
My shot in the dark was 4 million to get it started. And that was the estimate based off of just my work with the city and looking at the current investment in public safety. And I'll try to be very concise with this. When we talk about an prevention infrastructure, to truly be a public health based infrastructure that takes in account all of the social determinants of health that lead to violent outcome, you're looking at maybe at least an examination, if not a reorganization of all existing city departments or even state departments. Your Parks and Rec plays a role. Your Department of Infrastructure and Transportation plays a role. Your Department of Human Services, your Department of Public Health, your Department of Safety, your Department of Health, your department, there's social services, housing, education. So if we're talking about Denver alone, we're talking about Denver Public Schools. So all of these things, ideally, and this is what I was attempting to build when I was the director of the Office of Youth Violence Prevention, was a coordinated hub that had connections to decision makers in all of these different areas, and intentionally led with a model that actually the young people motto that the young people created is safety starts with me. So I charged every department leader within within the city and county of Denver, and then their employees, to view how they do their work, how they approve contracts or don't approve contracts with community-based organizations. How do they look at infrastructure and parks and recs? How do they look at streets, the environment within the streets and infrastructure with a lens of safety? So, I mean, a very modest estimate. I think lowball is 4 million, but honestly, if you're really looking at a prevention infrastructure, it should be the entire annual budget over many years.
I mean,
and I know that that's not an easy answer. So
it's not an easy answer, but it's like things are very backwards because the costs are so expensive for incarceration, for all the cost to society of what we're paying, for not having this infrastructure. And it's like, I mean, I sometimes talk about, like, with going to the dentist, if you've ever not gone for a while and you have then had to pay in your life of having to get the root canal and the crown, it's like, I know that's not the greatest example, but but we don't like going to the dentist, and prevention is not, it's just hard to show how much it matters. It's hard to show, it's hard to show the results, like, to build it properly. It's like in 10 years. I think it would, if we start.
It's generational. It's generational.
I mean, and so policymakers want the short term. So, I mean, short term, yeah, let's do the safe storage. Let's, do these campaigns. But if we're talking about what we really want for our young people, for our society, for the future generations, and I'll tell you, I'm in it for the long haul. I will be saying this stuff for the rest of my life and planting these seeds for wherever they go. But I mean, honestly, I think in terms of 500 years in the work. But you know what? I know that might bother some of you. It's okay if it does. Like, I'm not saying I'm not going to try super hard to do everything we can right now, but I want to plant the right seeds. I want to, I want to, it is generational, and we can do the things right now to lead to that generational change. Like, it's still going to make things better right now. If we're able to avert mass attacks, if we're able to not be the fourth state in the nation, if we're able to be the last state in, that we don't even have mass attacks in Colorado because we've built such an amazing infrastructure, that's going to make things better immediately. It's going to help everyone feel safer. It's going to, the trauma, the collective trauma of violence, like we don't even measure that. We don't even talk about that hardly, of like how that impacts people's lives and families who are like, Carly's life, her son did not die, thank God, in the shooting, but their lives are forever changed, and so many like that. So I just, like I said, I'm in it for the long haul. I hope, I hope I'm giving a mixed version of things we can do now, and that also are long term. And it may take a long time for us to get to where we want to go, but hey, let's go there, and I'm so grateful that you all invited me to talk. And you're actually, I didn't realize like the level of how connected you are to policy and to making this change and these changes. I hope whatever I can do to help. I'm not supposed to directly work on policy, but I can advise, I can give you what we know from research and all these kinds of things. So.
Well, thank you, Beverly. You've given us a lot of seeds and a lot of information that we can carry forth in all of our endeavors, I think. So thank you very much. You will give us your slides.
Wow.
Yes. Okay. And we will post those on the website along with the recording here. I think that there are probably some links in the chat that we'll want to keep track of. I thank you very much. And for those of you who are left, remember that next month, Rachel Dane is coming to talk to us about ERPO. So, the conversation continues. Thank you.